Hi there everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what are obsessive compulsive and related disorders? Ooh, Alright, let's get into what obsessive compulsive and related disorders are. Just before I get into that, there's one thing that I need to say, that this is not diagnostic criteria for any of these disorders. This is just a description. If you need a diagnosis, you'll have to see a trained, licensed therapist or professional. So don't use this information to go diagnosing yourself or somebody else. And also, if the labels of any of these, for example, body dysmorphic disorder, if that doesn't help you to heal, if in some way that feels like stigmatizing to you, you don't have to use the label. This is just quick descriptions to give you an idea of something that may be happening in your life or the life of someone that you loved. So that out of the way, what are obsessive compulsive and related disorders? I have notes I'll be looking down at just to make sure I get everything here. So they feature obsessions and compulsions. They don't have to feature both of them, but that's typically what you're looking at when you're talking about these disorders. So obsessions are recurrent images, urges, thoughts that are unwanted or intrusive. And compulsions are repetitive mental acts or behaviors that somebody feels that they have to do to either neutralize the obsessions or because they feel that there's some kind of rules that they need to follow, something like that. So those are compulsions. So all of these disorders are going to feature in some way some kind of an obsession or a compulsion or both. And what are these disorders? So we've got obsessive compulsive disorder, which features obsessions and compulsions, which are persistent thoughts and repetitive behaviors. You've got body dysmorphic disorder, and that is a preoccupation with perceived flaws, faults, or blemishes in your own body. And it involves repetitive behaviors surrounding those flaws. You have hoarding disorder, which is a difficulty in getting rid of unneeded, unnecessary things, unnecessary possessions that you have. And you accumulate them, and it kind of makes any living space unlivable and not able to be used anymore. You also have trichotillomania, which is called hair pulling disorder, where you repeatedly pull your hair, and that leads to some kind of hair loss. Not necessarily the hair on your head, could be any hair on your body. You also have excoriation or skin picking disorder, which is repetitively picking at your skin, and that forms skin lesions. You have substance or medication-induced obsessive compulsive and related disorders, which is when you have something that looks like one of these and it's happening because of a substance or a medication. You have obsessive compulsive and related disorders due to another medical condition, and it's when you have the characteristics of any of these and it's because of something that's going on medically with you. There's other specified obsessive compulsive and related disorders, and that's when some of the features of these disorders are met but not enough to meet the full criteria, and there are other diagnoses that could be made here, and I'm going to try to pronounce them as best I can, but something that might fall under other specified obsessive compulsive and related disorders could be body dysmorphic-like disorder with actual flaws, body dysmorphic-like disorder without repetitive behaviors, body-focused repetitive behavior disorder, obsessional jealousy, shubo kyofu, koro, and jikoshu kyofu. And then we also have unspecified obsessive compulsive and related disorder, and that is something that would be used in an emergency situation when you don't have enough information to make a full diagnosis, but it's looking like it could be one of these things. So that's just a quick description of what the obsessional compulsive and related disorders are. I hope that gives you a nice, good, well-rounded description of them, a good human perspective on them. If you have had an experience with any of these, I'd love to hear about it, so leave a comment below. And I thank you for taking the time to learn about this with me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.